we can facts. Okay, then without further ado, I invite Prime Minister to begin the debate. Here, here.
Hi. Okay. Um, am I audible?
Loud and clear.
Okay. On our side of the house, we regret private health insurance for exploiting the vulnerable individuals, for preying on those who have nothing but require treatment to get better and to actually uplift themselves out of poverty. Right. So some framing first, private health insurance, it's very costly and it's just accessible to the wealthy, and it doesn't cater for those individuals who cannot afford this kind of insurance. On status quo right now, we see a society who is very stressful, where many people are dying, many people cannot afford this kind of healthcare, and people are refusing to seek treatment because of the cost, because of the high cost, and there's because it's private health insurance, and we think that this is a basic right that's failed to be provided by the state, and private health insurance shouldn't be able to take this basic right out of individuals who cannot simply afford private health insurance. Right. So the policy in this debate, we tell you there's going to be a on our side, it's going to be a single pay healthcare system where the government is the direct provider of this healthcare system, where you pay into national insurance aids, and clinics are going to be set up everywhere, even in the most remote and rural areas with poor people. And this is similar to the UK system of NHS or Sweden and Denmark system, right? Where it's this kind of insurance is paid for by the national insurance tax, right? So we tell you also that because right now there's progressive taxation, there's more inclusion and equity in our policies, where government is already taking into account everything that you contribute into taxes. At the end of the day, we think the ability for people to afford a malaria jab is so important, that it's so worth it, that any financial cost to save a rich guy is just something that we're willing to trade off. Right, the sanctity of human life is much more valuable than any financial cost to some rich guy. If opposition say that it's unfair to people paying taxes, we think this is already refuted out of the debate, as long as we're willing to say that we're willing to trade this off for the sanctity of a human life. So three arguments in our case. First of all, how we get more access healthcare for poor individuals in terms of financial access and logistical access. We think that we get more financial access for poor individuals because the government then subsidizes more for this kind of healthcare. So the poor is being charged less. Therefore, they are able to access this kind of healthcare. So there's equal opportunity to receive the basic rights to be treated. We think that the state has an obligation to do this because they're obligated to protect the most vulnerable, because these people are a result of the oppression of the state and the state failures, right? The system of the state, and also because they have nothing to turn to, and this is the only alternative for them to actually receive treatment and to actually receive the basic right of these individuals is actually governments subsidizing for their healthcare. Yes, I'll take that.
Yeah, you seem to be thinking that this debate is about public versus private healthcare. This is about private insurance. These are very different things.
Yeah, we it's quite similar in terms of the sense that you need insurance to actually access healthcare in the first place, right? So moving on, private healthcare, we think it's also in terms of it's very predatory, where they keep raising premiums and they make people go for the most expensive treatments possible. On our side, we refuse to allow people to be treated this way. You can actually get healthcare and at any time you want, and you can actually access healthcare for these poor people, right? But also on terms of logistical access, we think that private health insurance is profit incentivized, right? You don't operate in rural areas at all. We think that rural areas then lose out on this on medical experiences and medical treatments. You turn these individuals who cannot access these treatments because it's very far away. They then turn to rural methods, which are very harmful and dangerous. For example, like those like burning a leaf, or like burning your wound, things like this. I think that the impact of this is that you harm the poor in terms of their health, because they result to extreme measures, but also they just choose not to be treated at the end of the day. Why is this so debate winning? We think that it's because of the vulnerability of these individuals, but because of scale too. Because if you don't treat these individuals, it will also spread to other communities where more people will be affected. So we think that the scale of this argument is very big. Because you don't treat these individuals, you also harm the rest of society. But second of all, on research, right? I think that because private health insurance is very profit incentivized, research on cures, treatments, and new drugs will be centered around their clients' demands. And because their clients are very rich and wealthy, these are things that are not the same as what poor people face, right? It doesn't focus on diseases from the poor, for example, like water sanitation problems or animal diseases, for example, like Ebola, things like this. On our side of the house, we will focus on everything as long as there's a need for individuals, no matter how rich or poor they are. This is so important because diseases that require attention, that require the most attention, don't get this attention because there's no money in it, right? But this shouldn't be the metric on who gets treatment and who doesn't get treatment. The impact of this argument is that poor people will more likely to get because poor people who are more likely to get sick because they're exposed to worse conditions and they have lesser, PPEs to prevent this disease in the first place. They're also less likely to get treatment because they have no money. Then you must care about this because the state has an obligation to protect the most vulnerable because they have no voice and because they're left oppressed by the society, but also because it will soon affect the rich because on scale, we're better in the future. Because if you don't put money into research, into treating these diseases, at the end of the day, it will also spread to other communities in the future, right? But lastly, I want to talk about how this is just a source of anxiety and stress for the poor, right? Because for the poor, if you're an individual living in poverty, you can never get out of poverty because you're always going to face the threat of being sick or you're always thinking about whether you can afford the next medicine because of your diabetes. Like you're always going to be thinking of whether your premiums will increase or not. It's out of your control too. So you're always having this anxiety behind you whether you can afford your medicine and whether you can afford treatment at the end of the day because you need it so badly, right? We think this is a source of anxiety and stress for the poor, and this is very bad because then they will not be able to go on with their daily lives and do other things because they're always thinking about the money and the cost, which should not be the way because the basic right of human is to actually get treated and to actually live a very safe life, right? So we think this is very harmful because they're then never going to be able to go out of this poverty cycle because they're never going to succeed in life in terms of other things because they're always constantly stressed about whether they're gonna be able to afford healthcare. And for all these reasons, because we protect the most vulnerable, never been prouder to propose.
I thank the Prime Minister for that speech, now inviting Leader of Opposition to begin the case for op. Hear, hear.
Am I audible?
Loud and clear.
With POIs, please verbalize them. Just give me a second to get set up. Starting my speech in 3, 2, 1. Opening government's fatal flaw in this debate is that they draw a false comparative between universal healthcare and private health insurance. These things are not mutually exclusive. It is not our burden in this debate to defend a world where universal healthcare doesn't exist, but private health insurance does. This is insane, and I would request that you don't count this as our burden in this debate. So what actually is our burden in this debate? So on setup, nothing in this motion actually says universal healthcare doesn't exist under both sides of the world. So we can defend a world where things like Australia's Medicare exists, but private health insurance exists to complement that. Note that Gov can't point to the US as an exception because they are the outlier in terms of this. Pretty much every other Western liberal democracy and a lot of other countries that aren't Western liberal democracies also engage in this kind of thing where they have a public kind of insurance fund for their citizens as a whole that doesn't cover things dental or elective procedures, but people can actually get private health insurance to complement their coverage to access things dental without having to pay for procedures by themselves. So what does private health insurance actually look like? Private health insurance looks like things like dental plans because dental and cosmetic dental stuff usually isn't covered under a universal healthcare. And it looks like things like elective procedures. For example, if something improves your quality of life, but it isn't medically necessary for you to live, then public health insurance probably isn't going to pay for that, but private health insurance will if you have it as part of your coverage. And this doesn't cover things like medically necessary treatment, which is already covered by universal healthcare, which is just like a truism that you should accept in this debate. So our first first substantive push in this debate is on allocative efficiency and why money is just spent much better in the healthcare system under our side of the world. So firstly, on weighing, just note that time is life. So the faster people can access treatment, the more lives are saved. And I'll explain why this is relevant in a second. So firstly, on why the healthcare system becomes more efficient, there's a financial incentive for companies, for insurance providers to actually work with people like pharma to innovate and provide more new solutions to their ailments. In order to actually maximize the amount of money they're able to make, right? Because obviously if you have like new treatments that are able to cost less, then it's just like making money effectively for these insurance providers. So if they are able to fund these new treatments and it is in their interest to do so, then they probably will do that. Secondly, this alleviates burden on the public system, which means there's less people reliant on the public system for their healthcare, and there's a greater capacity for the public system to actually help people. This means there's less financial pressure on the public system because like the public system doesn't have to like pay for like rich people's treatments. They can pay for it themselves using private health insurance. They only have to focus on people who otherwise wouldn't be able to access things like medical treatment without private health insurance. Secondly, there's less administrative work and bureaucracy, which means there's like less, if there's less claims flooding through the public healthcare system, then that means that they are more able to actually focus on and offer a high quality of care for those who are unable to get private health insurance, which is why people who are like priced out of private health insurance, while this doesn't like negatively affect their healthcare, this does affect the speed at which they're able to access care. Does private health insurance improves the quality of care for these people who are not able to access PHI. Finally, there's a more capacity for research and experimental treatments in the public system itself in a world where less people are reliant on public health care. Because like obviously if you're spending less money on things like, I don't know, like fixing like a rich guy's like cough or whatever, then you can probably spend that money on things like innovation and funding experimental treatments for people who are unable to access it under a comparative, which is side opposition to world where you have private health insurance only and no universal health care, which is obviously the burden that we are forced to defend in this debate. Moving on to the second substantive push in this debate is on innovation and quality of care. First mechanism here is on competition, because obviously if insurance providers are incentivized to compete to attract customers because universal healthcare already exists, then there's more options for people, they're more incentivized to provide options for their customers, like custom coverage based on what chronic illnesses you might or might not have, or experimental treatments for like illnesses that are like new to medicine, right? The weighing list is incredibly clear and is by far the largest impact in this debate, but for the most vulnerable subset of patients, that is the people with chronic illnesses or medically novel illnesses, private insurance companies are able to like fill gaps in universal healthcare, and people are able to access a higher quality of care under our side of the house because of the fact that like universal healthcare is much more efficient and private healthcare covers their chronic illnesses. A last substantive push in this debate is on the increase in consumer autonomy, because obviously autonomy is just good. Like you know yourself best. So if you have like this chronic illness and you want to like be able to like make sure you're like covered for that, you don't want to like pay for your procedures yourself, then obviously you are well within your right to go out and seek private health insurance. And actually get coverage for what you need and what you don't need, etc. I've just explained why custom coverage is likely to exist, because insurance companies want to compete with each other to provide for customers as best they can in order to attract the most customers. So it is in the financial interest of these companies to actually do this, and it is in the financial interest of like private citizens to engage in custom coverage through their private health insurance. And finally, on the second mechanism for which we increase consumer autonomy is through choice, because obviously the people who are able to afford private health insurance probably make a decent amount of money, and they have the right to spend the money on what they want. In a world where universal healthcare exists, which is the world we have to defend, there is no cost to not buying private health insurance. So it's like you're not like coerced into actually buying private health insurance in the first place. But this is something that's like maybe financially makes sense for you, and maybe you want to do at the end of the debate. I'll take any POIs from closing, preferably. No? Oh, okay. Anyways, at the end of this debate, Gov is defending a world where universal healthcare doesn't exist. This is incredibly uncharitable and not our burden to defend. We posit that there's a subset of people who can and should get PHI if they have like the financial capacity to do so, and if they're in a position to benefit from having PHI for things like dental plans or things like cosmetic surgeries, or things like, I don't know, elective surgeries that can like maybe they're not like going to save your life, but they are going to massively increase your quality of life. Maybe like instead of like being like bedridden for the rest of your life, or not being able to like breathe properly, you can now get like, I don't know, something to do with your lungs, and maybe you're not able to like breathe properly and do sport or whatever. Like we'd argue there is immense value to be gained from having private health insurance that actually covers these kind of treatments, because it is just like what it allows you to like live your life when these things cannot like feasibly be covered by the universal health system. Like these things are incredibly draining. So when the public health system is unable to like actually pay for these kind of treatments, you are unlikely to be able to access you're unlikely to be able to access these treatments in the kind of factual, which is why private health insurance is so necessary to improving people's quality of life in general, which is why I'm so proud to propose.
Cool. I thank the Leader of Opposition for that speech. Now inviting the Deputy Prime Minister to end the OG case. Here.
Hi.
Sorry, you're a bit laggy. Could you like say a longer sentence?
Hi, can I be heard now?
Oh yeah, it's great.
Okay, cool. Let me set up my timer. I'm gonna firstly deal with OO's case, then come back and reinforce why our side's case is actually debate winning. Firstly, in terms of the OO case, I want to note that the caveat they make out of non-essential treatments are actually rather important for these individuals. They mention things like, for instance, dental surgeries, as well as things like elective care. Dental surgeries and elective cares aren't just luxuries that you can choose to live without. For instance, for an average person, having a persistent toothache or a persistent root canal issue that may not necessarily kill them, but will probably hurt a lot, can impact their day-to-day living. For instance, a poor worker who has an untreated tooth infection that won't kill them will probably have to live a life of suffering if they can't afford the treatment for it anyway. Furthermore, for instance, let's say you want to do elective non-essential physiotherapy to enhance, for instance, the mobility of your leg. This can, for instance, help people that are, for instance, trying to pursue athletic careers or working in sectors that require physical labor to do things far better. Sure, you can live without it, but I don't think you'd be living very well if you were to spend the rest of your life in a wheelchair rather than going for these elective procedures. We think then that this gatekeeps higher quality of life towards exclusively the rich, which is an issue that exists, which is the issue that we're exactly trying to solve on our side. Because we think that life goes beyond simply staying alive. It goes to the extent that you're actually living a dignified and comfortable life, which is ideally the goal of what government healthcare policy is. For instance, many governments today, many more progressive governments today, actually do things like, for instance, under government healthcare coverage, include things like, for instance, free elective screenings. These elective screenings are things that help you with life-saving scans or screenings such as blood tests and cancers. Sure, these things may not necessarily be an immediate life-threatening issue, but they will certainly matter for, at the very least, your quality of life, or in the most extreme cases, be an early warning detector for things that will actually harm your life. I think this is far better because on their end, at the very best case, they're simply waiting for people to have serious issues. And as such, we think that private healthcare, the private insurance system under this doesn't really cover enough. Secondly, they mentioned the omission of novel illnesses. I would like to note this is incredibly important because it ties into Angun's game-winning argument about public research and public healthcare coverage on more novel illnesses. This is incredibly important because novel illnesses are very rare. This means that very few people have these illnesses, and the people that will actually resort to PHI for this under the opposition side will have to pay immensely high premiums simply because of the risk pool and simply because of how few people there are and simply because of how unprofitable it is for these firms to cover them. This means then, no thank you, that these illnesses are unlikely to be covered at all, or if they are covered, it will be incredibly high in terms of the cost. Therefore, we think that their system simply does not cover enough. I'm going to firstly respond to their first substantive. No thank you. On the idea of efficiency. Here's why their system is high. Here's why they can't have it both ways. Their side claims that the public system is incredibly overloaded. If so, I don't think they can necessarily stand for public health, for universal healthcare either. This is the key contradiction at the crux of their case. Because the things that overload the public system in a universal healthcare system are life-saving things. For instance, the things that take the absolute most time are things like organ transplants and surgeries, as well as things like regular consultations. These are very important things that most of us can agree are essential. Therefore, if they want to not overload the system, they can't necessarily support their model of of a private-public partnership either. Next, the other side mentions the idea of innovation and competition. I'm going to respond to this by simply pointing out what the reality in private healthcare is, which is that these healthcare providers are often existing in cartel-like systems, in which case there is very little incentive to truly innovate or to truly outcompete one another. This is because these are very high barrier to entry fields. They require, for instance, extensive connections with the medical industry, a high amount of capital to cover these costs, as well as a large consumer pool. This means then that very few healthcare companies actually do exist. No, thank you, sir. In the status have existed in the status quo. This means that this cartel-like system would have it be more instead. Sure, I'll take that point.
Opening
from closing.
You said that public health insurance have like free elective screenings. Do you think that there are free elective screenings throughout the whole world?
Sorry. Could you repeat that? I didn't hear it. Sorry.
Okay. You mentioned earlier that there are free elective screenings on your end, right? On public health insurance. But do you think that could be applied throughout the whole world?
Yeah, we think that even for nations that have, for instance, poorer money, less amount of capital in terms of their governments as opposed to even wealthier countries. For instance, even in Cuba as opposed to America, there are better healthcare outcomes. This is because of things like This is because their universal coverage system allows for things like more screenings, more elective procedures, as well as a better doctor-to-patient ratio. We think that money isn't really that big of an obstacle as your side would probably want to make it out to be in your closing half debate. Yeah, okay. So lastly, on the idea of choice and customization, we think this isn't really an argument because if you want plastic surgery on our side, sure, you can go to a plastic surgeon and pay for it. I don't think that's necessarily really like a medical issue more than it is just some aesthetic thing. And furthermore, choice in terms of what procedures you want, I think it's covered on our side as well. Because presumably on our side, we'll equally say, yeah, sure, the government will probably try its best to cover everything as well. We think that choice isn't really a thing in this debate either. No, thank you. I'm now going to reinforce why the arguments under Anggun's side are incredibly match-winning. This is because OO hasn't dealt with the core crux of this debate, which is the idea of achieving some form of equity and parity in terms of the healthcare system. Even things like when it comes to the basic outcomes of what healthcare policy should be, it should generally be speaking centered around the government trying to provide the maximum amount of capital, the maximum amount of welfare and treatment possible for humans. This therefore means that under your side of systems, where at the very best case you have a cartel that overcharges its patients as opposed to a government who can operate at a loss due to its income from other streams such as its own investments or taxes, or at the very least sell at a system that, let's say, breaks even. This means then that on their side, customers will face higher prices. This means that people will outright refuse treatments, not be able to afford treatments, or overlook medical issues. We think this is incredibly harmful because human beings are dying. This is the core difference here. On our side, we have a range of coverage, and this is more important than having elective coverage, because this means that the issues that are not being addressed that truly matter to the most vulnerable and the most at stake actors today are actually impacted. That's why you have to go with OG.
Cool. I thank the Deputy Prime Minister for that speech. Now inviting the Deputy Leader of Opposition to end the opening half of this debate. Hear, hear.
Hi, just confirming that I can be heard.
Loud and clear.
Lovely. POIs verbally, please. Yeah, take that. Oh, okay, that's right. Actually, yeah, can you do that as well? Or just voice memos this? All right, starting my speech in 3, 2, 1. I kept trying to POI DPM because I wanted to help them. Because the problem with the OG case is they say, well, the counterfactual is you just have universal healthcare. and that would solve all the problems ever, I guess. But the problem with fiat is when you have so much of it and you're trying to prove something that's quite large, you can't just say it will happen. You have to prove why it's likely. And what I was trying to ask in my POI is why is it actually likely that these public healthcare systems are going to get so much money that they can solve all the problems ever? Because on our side, if we had that much fiat that they're trying to claim, I'd just say, well, we'd cure cancer, and then no one would have cancer, and then the world would be fixed. Like, obviously, that's not the case. They give you no reasons as to why it's likely that you're going to get a substantially larger amount of money into the public system, so much so that it could solve all of the problems that exist. And obviously, I'm not just going to say they didn't prove it and therefore they lose. Here are 4 really, really big reasons as to why they're not going to get anywhere near enough money that they need in order to be able to make meaningful change. The first of which is that public system is often slow, overburdened, and criticized. And for that reason alone, they often have to do things like prioritize. People often have bad experiences with them. They don't want to support things like the public healthcare system in general. Certain people do just get left behind. Certain people do just miss out. What this means is the people that they want to suggest and support under their side, the people who just, like, I don't know, want dental and can't get dental because they can't get private healthcare. That's ridiculous. They wouldn't be able to get it under their side either, because if someone has a toothache and they have someone who's got, like, I don't know, a lung blown off in a car accident, obviously they're going to prioritize the guy who has a lung blown off in a car accident. This is damning for the public healthcare system for a few reasons, but the most important of which is they lose all the political capital that they might have gained. In order to get more funding for something, you have to prove your worth. That's how democracies work. That's how we prove how you get more funding for things. And there's been problems in public healthcare systems all over the world for years, yet we consistently get no more amount of money pumped into them because there's such a negative reputation surrounding them, because they are perceived to be inefficient, because people are perceived that they're not working hard enough. The problem being that people perceive that they don't have a profit motive and therefore aren't doing the best they can to be the most efficient. This is why the private healthcare system stepped in. This is why what happened in the last 30 years happened, because we had an issue that needed to be solved, that could be filled by the private sector, where there could be an efficiency push, where we could get more resources into a place that mattered, where we didn't have to go through things like enormous amounts of red tape in the government. The private healthcare system solved this problem. But the last and most important reason, because obviously the counterfactual under our side isn't that we just have to defend pure private systems with no public. Obviously, it's a hybrid system, because that's what happens all over the world right now. That's what happens in Australia. That's what happens in England. Most major democracies do just have this hybrid system where you have some level of private and some level of public. But this is actually good for the public healthcare system too, because the number one issue that both teams identify and both teams point out with the public system is they don't have enough resources to deal with the massive amount of cases that they have, massive amount of problems that they have, huge amount of influx of people that they do have, and the inefficiencies that are there. The benefit of the private healthcare system is that you can have, like, a healthcare system for things like dental that can be really super efficient in processing just dental cases. And that means they don't have to go to the public healthcare system. So there are more spots there, there are more availabilities there, and obviously there is still that base level of political capital of something like the public healthcare system. People still do want it. There is a large enough amount of audience who maybe can't afford public healthcare system under our side, who are still going to campaign for that public healthcare system under our side too, which just means that there is less of a burden on the public healthcare system under our side. People get more efficient treatments more quickly. There are very few responses to this, and they're quite bad from the opposition, because they try to tell you that, like, well, we're only treating niches that don't matter, and therefore we shouldn't care about our side. A few responses to this. The most obvious one is, well, niches matter too. If they want to claim life and they want to claim the sanctity of life that exists on such a large degree on their side, they're just, like, pushing people to the side under our side. That seems kind of bad. But the second and more important explanation is it's not just niches, it's experimental treatments. And they might try and say the exact same thing now and be like, well, experimental treatments, who's that really going to help? Experimental treatments is how you make breakthroughs in medicine. It's how you cure cancer. It's doing things differently than they were done before. It's how vaccinations were invented. It's how all the most important breakthroughs in medicine have happened in the last 30, 40 years. It's when you've had a private incentive to do something. It's not when you've had, like, a government grant that's gone and solved the problem. It's where you've had companies like Pfizer develop vaccinations for things like COVID. That is the most beneficial part of the private healthcare system. So even if you believe that a lot of people are locked out from accessing the private healthcare system, you should believe two things at the end of this clash. You should firstly believe that the public healthcare system becomes more efficient as a result of private health insurance. But you should also believe that the amount of people that are benefited are people that matter, not just because they're niches, but because they do things like experimental work. They fund things like experimental programs, which are very likely to cure things that are very large problems in the medical industry. So clearly, if you care about efficiency, if you care about people being allocated, if you care about the sanctity of life on the OG side, you should obviously value private health insurance, because that solves that problem as well. So we win on their best metric. But we give you a second one, because we also explain to you that things like autonomy matter, and things like being able to spend money in the way that you choose matter. We give a variety of reasons for this, but the most obvious one is that consumers have autonomy, and if they want to spend money on something, they should be allowed to. If I want to insure myself, I should be allowed to. But the responses that we get to this are twofold. The first thing that they tell you is that these are often operate in a cartel system, and therefore they're bad and they make them overly expensive. The easiest response to this is public healthcare system is a monopoly. So if you believe that like being a cartel and or a monopoly is bad, they have the worst version of that. But they say, well, you can operate at a loss too. But the problem with this is this makes you have no incentive to be efficient. You have no incentive to solve problems. That is where the private healthcare system steps in. And that is why the private healthcare system has solved so many healthcare crises that have existed across the world in the last 30 years. The second and perhaps better response to this is, well, if you want plastic surgery and do things like those sort of experimental, weird niche treatments, you can just do it under our side if you want to pay the money. Like, maybe that's true, but obviously that's not the greatest stakeholder that exists, and that's not the most important stakeholder that we care about. But before I move on, I'm aware that I'm nearly in protected time. I'll take a point from opening. Please.
The crucial difference here between public and private healthcare providers is that private providers still have an incentive to jack up prices to attain a profit, whereas the state is willing to operate it at either a break-even point or at a loss.
Okay, firstly, this doesn't respond to the efficiency claim. Secondly, if it was so expensive, people wouldn't buy it. People are quite intelligent consumers. They're not going to purchase something that has no value to them. But thirdly, and more importantly, no, you have multiple different agencies that are trying to price each other out. There are like 30 major private healthcare companies in Australia alone. We are a relatively small country. Obviously, there are more of those in other countries around the world, which just explains to you that you have that incentive to drop prices down, not jack prices up. If you are doing something like an anti-competitive practice, that is literally illegal. You can't do that. Obviously, that's not something that's going to occur in a large enough of a quantity in order to be a major issue. But secondly, on this plastic surgery response, they say it's about things like plastic surgery, but it's actually not. It's about if you have major recurring dental issues in your life, you should be able to insure yourself for dental care, so you don't have to continually go and pay for dental care. It's just good financial practice, and that is very useful and very common. With a lot of private healthcare insurers, there are like different ways, like the most common forms of healthcare are things like dental, physiotherapy, and chiropractic. And if you're someone who like prefers one of those three things, you should be able to insure only one of those three things, or two of those three things. Or if you're someone who's like really messed up in the body or something, all three of those three things. The point is, consumer choice is beneficial. Consumer choice is good. If you have money, you should be allowed to spend it. But that's how we win on our side. But we win on theirs too, because obviously we claim that the system gets more efficient in both the private and the public sector when you introduce the private sector and private healthcare insurance. Clear 0-0 win.
I thank DLO for that speech. Now inviting the member of government to begin the closing half of this debate. Here.
Give me a minute. Thank you. I'm audible.
Loud and clear.
Okay. Here I preferably from closing. Start my speech in 3, 2, 1. There are two deadlocks on the opening. The first one is whether or not how does the PHS system affect governmental services, even if they do exist in a hybrid system. O argues that both of them exist in the same world. OG doesn't respond to this. I need to solve this deadlock. I just need to explain how the PHI system actually makes the public healthcare system worse, which solves this old assertion that because it exists in a hybrid system, it is still not going to be bad. The second deadlock here is whether or not these PHI systems are exploitive. O says that they aren't so because there's competition that exists internally within different types, different companies of PHI. OG says that then comes out and say that they operate under a cartel system. I have to explain why, even if the competition exists, these PHI companies are already structurally exploitative. I want to give you more reasons why they are exploitative on the ways they exploit individuals instead of just saying that they're profit incentivized. Two extensions that I want to posit in this debate. The first thing is on how they're exploitative towards consumers. The second thing on how there's a state obligation to protect them. I think the first thing, the first argument on why they're exploitative consumers, I think two things that I will explain. The first is why it's true. I think the premise is simple, is that PHI oftentimes lack accountability. There are three things why. A is that they want to make money, right? So they have a lot of terms and conditions that are really complex because they want consumers to just automatically opt into these insurance by heavily marketing the few benefits they do get. Right? This means that it's essentially harder for consumers to understand the additional add-ons for these premiums to activate, or these things like coverage limits, for example. B is that PHA oftentimes deny claims based on technicalities and conditions that aren't immediate when consumers initially buy this insurance. And the way they do so is within three ways. A, for consumers that already have a pre-existing medical condition before they opt into this insurance, a lot of policies that excludes funding for pre-existing medical conditions don't really fund for them. B, a lot of policies exclude certain types of healthcare treatment. They're usually going to be expensive, or they are like. Or like these, oftentimes these PHI companies, oftentimes they have like these things called healthcare networks that also excludes like treatments provided by facilities outside of this network, for example. But see, the decisions that PHI oftentimes make are going to be private. That means that there's just minimal ability for the average consumer to oppose these decisions. Exactly how they're profit driven, they're likely not going to opt into these expensive treatments. It's exactly because these like PHI companies, oftentimes they delay and deny like these like insurance that like Luigi Mangione essentially killed the CEO. But thirdly is how these they also usually do delay these claims by requiring for additional claims, or the claim review process itself is intended to be lengthy. Because these insurance companies operate on a large scale basis where they have a lot of consumers to cater for, meaning the process in of itself is already going to be lengthy because they have to review a lot of different types of claims, for example. Why is this important? Because of two things here. A, for a lot of minorities from rural areas, for example, or for people who are impoverished, when they already lack education to begin with, there's already hard for them to understand these opaque and these understanding terms and conditions, so they just buy anyway, right? Exactly how these people buy these high prices for like later on for these premiums, they're already economic struggling. This even worse when this PHI doesn't activate to help them to any extent. But B, for people who already have pre-existing medical conditions, are like to be unable to claim this insurance, or people who are already sick gets delayed and prolonged off from this insurance. I think this is a life or death, like life or death thing, right? This is bad because like these groups of people are the most vulnerable groups of people that require this insurance the most. How do we outweigh opening from this argument? I think OG's only frame to why PHI are exploitative is that they are profit incentivized. This doesn't engage with OO's frame on how there's competition, which beats off that profit incentivized argument. We give you reasons why structurally they're already exploited because they deny claims, or they just deny claims overall, which leans on the likelihood analysis of why they are profit incentivized, so they'll be exploited. Or even if they aren't that profit incentive like under OO's, because they have a lot of consumers to cater for, that means that the process that they do have to go through is going to be long. So even if there's still this competition, I think there's going to be such a lengthy time for these individuals, right? Second argument, how there's this state obligation to improve the insurance and the medical healthcare system overall. OG mentioned this about on one line, so we're actually going to prove it to you. I have three questions and answer. The first thing, why healthcare is such a fundamental right to the state that the state has to protect it. Two reasons. A, health is basically the life and death of citizens. This is the most fundamental right that people do have, because only with a healthy body they're able to enable other forms of right. But B, the citizens are born into a state where they cannot choose their own choices and on this premise then. Therefore, they vote for governments in which they trust them to protect this essential right they so have. Second question I'll answer on how PHI locks this problem. Two ways in which it's likely to be true. A, this creates a stigma when people with the existence of PHI, because this literally ties healthcare to individuals' ability to pay. If you're a rich person, then you deserve to be able to have a healthy body, etc. Right? Well, this means that this creates a stigmatization around public healthcare services. But B, this creates a two-tier system when PHI market themselves as fast and effective, but eventually, realistically, they aren't, right? So this makes people, and with the really toxic commercialization that PHI do launch, this makes people more intent, this makes people believe PHI is a much better system overall, which makes them more likely to believe to not opt into other services, right? But B, it's on how there's less incentive for governments to improve the healthcare system overall. I think A is that governments will just assume that people with PHI will be less reliant on public healthcare services when a large proportion of people already opt into PHI because of the exploitative commercializations of PHI that targets into these individuals. Right. Then they will just decrease the funding from this system, from the healthcare system, and go and invest into somewhere else. Secondly, C, the services that PHA provides just tie back into other types of
That's
private medical later. Tie back into other private medical sectors. Instead of using government services, they make you to opt into private hospitals. So unless people use public hospitals, because of a significant proportion of people opt into PHA, then it just makes like the overall public health care bad. This also answers to OO's assertion. They're correct in pointing the public insurance and healthcare to exist. We explain why, because PHI exists, they makes like the overall healthcare system worse. We solve this problem exactly without the existence of PHI, and people will just opt into universal healthcare system. Why is this then the state better in providing this insurance? I think if the state fails, then the people have the power to go against them instead of people having the power to go against these like capitalistic structures. They can just literally vote them out, or they can oppose them within referendums, or they can portray the state as horrible. Why is this automatically win us a debate then? OG argues that they have better accessibility when state control this. No, this isn't just about accessibility, but because but on the quality of assurance that you get from these insurance provide. But see, the benefit on accessibility only exists when they explain why the existence of PHI knocks away government-funded insurance. This our analysis is analytically prior for opening's argument to stand. But B, in order for all benefit of consumers to unlock, it is contingent upon the competition within insurance companies. But even with this competition, exactly how we give structure why companies will still be exploitative because they are for profit of competition or of pushing companies to be better is uncertain. This benefit of state exists regardless of this competition or these reasons proposed.
I thank the member of government for that speech. Just a reminder to all speakers that you have to stay within 7:15. I won't be taking any notes after 7:15. Cool. Now inviting member of opposition. Here.
Hi, I'm assuming I'm audible. Hold on. Give me a couple of seconds to start my timer. But in the meantime, hi everyone. I'm Jodo, pronouns he, him. I will be the member of opposition, so just, pronouns he, him again. And POIs through chat, preferably through the fitment mark. I'll try to take them if I can. Yeah. Also, please don't badger on the chat as well. All right. So, all right. So starting my speech, let's all count of 5, 4, 3, 2, 1. Okay, so my family is very prone to sickness, with over more than 7 visits to the hospital last year, with different illnesses for like each visit. Talk about unlucky, right? The thing that made it easier, however, was the fact that it was all covered by my family's private health insurance that managed to relieve the stress of trying to find thousands of pesos just to be able to afford x-rays, blood tests, inpatient statuses that left us in a pickle for days, wondering about how our family members are doing. In some cases where I myself had to judge tournaments while in the hospital, lovely fun fact. But regardless, whether or not government wants to admit it, private health insurances have done so much for us that yes, the qualifications need to qualify was worth it. The weeks of applications in order for it to be approved, we went with it. And the trade-off we are willing to take in order for us to have the safety for our families' well-being, being proud to oppose. So firstly, I'd like to start off with a couple of responses. All right, so this is going to be enough of my case. I feel like opening half totally misunderstood the framing of this debate. So let me tell the judge what these are. Firstly, opening, I feel like focused too much on the discussion of like the healthcare systems and how this essentially affect the healthcare system in general. Like, girl, this debate is about private health insurances. Okay, what are actually private health insurances? Like, what are they? Private health insurances are like insurances that we can subscribe to in order to have or at least try to remedy at least of the expenses that you have if you're going to the hospital or seeking at least proper professional medical care. We have processes in order to actually be able to approve these services. It will depend on the person's demographic background, net worth, income, and company that's sponsoring the insurance, or the company needing that insurance from the worker in order for them to actually be employed. It also comes with plans and whatnot, so it's not necessarily something that's a one-size-fits-all. It has multitude of services and multitude of coverage. So what are the public health insurances then, right? Public healthcare systems are systems that are public, depend on the offering of a lot of services from the state that came from tax-paying money and whatnot, and have been used and have been produced through a couple of years, have produced like subpar quality of services because of the fact that it's usually used by the public, that it has a stretched out allocation of budget and resources in the past, and it has already been regulated by the private health insurances, which we'll talk about later, which is why we don't regret this motion. So I'm just going to throw in another extra couple of framing then just to be safe. Like Luigi's account company, the insurance, the CEO of the company, we admit that it's going to be bad, but it's not necessarily in general, right? Like not all of the health insurances, private health insurances in the world are bad. And like, firstly, some of them are actually really good. For example, some private health insurances are in Switzerland, for example, are actually really good with covering a lot of hyperthermic medical expense care, or like private health insurances that are used by like companies that are by like countries that are usually prone to like BPO industries, for example, here in the Philippines, where a lot of private health insurances actually cover a lot of the people that work in the corporate world, right? So I feel like this overall generalization that a lot of private health insurances are bad, that they're going to just be after your money, it's not going to be very for the people that are low-income income. I feel like it's just a very unfair generalization, right? So I feel like something that's going to delineate us from our opening is that we're basically framing this whole debate isn't about the public healthcare system, although we're all also going to be providing benefit on that. We believe that this debate is about whether or not the impact of the private healthcare insurances were actually enough for us to not be regretting it. So two line of arguments for the speech. Firstly is on the lower income demographic, like how it works. We agree that it has long processes, yes. You need to have a lot more variety of subscription forms, and has a lot of requirements in order for these lower income demographic people to actually acquire it. But these are small parts of percentages of like their salaries in order to make way for this form of security, where these individuals don't have the capacity to actually afford a lot of medications in the world, especially with the increasing prices of medication by the big pharmacy companies, and also the rise in global prices of consultation that has been slowly on the rise since the early 2010s, but skyrocketed post-pandemic by a lot of doctors and professional medical healthcare. So why exactly would this happen? We believe that there are three reasons why this is likely to happen for these low-income people to opt into it. Firstly is that usually accidents can happen to them. They are accident prone. Lower income people usually are in the working class, or most likely working blue-collar jobs, for example. They go to dangerous areas or dangerous in work environments. They also danger-prone jobs that they need to live paycheck to paycheck, but they also incented to actually pursue these multiple jobs, even if they're how dangerous they are, because they need to live that off in order to pay for themselves or pay for the family that they're trying to feed. So we believe on side of opening government, they try to tell us that there are systems that can actually work. For example, universal healthcare system, for example, we believe in this too, but we think that although there are some countries that can't necessarily offer this yet, we believe that private health insurances are going to be something that is a much better alternative before we get into that process of actually mandating the state to have these universal healthcare systems for a multitude of reasons. We believe that these private healthcare insurances may not be the best, may not have the best reputation like countries like the US, but we believe that it's a proper safety net for these people that can't necessarily afford to actually pay upfront or pay fully through these types of illnesses that they might go into their hospital from for whatever reason that they might go to. So it's not necessarily also just going to be helpful for them and convenient, but it's also going to impact them in terms of like urgency and how are they going to be able to handle this type of financial burden on their own side. So it may not be like the future best, but for territories or countries that don't necessarily have like any proper public health insurance systems or any like universal healthcare, we believe this is going to be the much better option for them to take anyway. Second argument then is on the principal and practical cases of like helping middle class to upper class people, but also indirectly helping lower class income people in their own needs, right? So the middle class often gains privileges such as access to better education, healthcare, and opportunities, right? Because they have worked hard to achieve the financial stability. We believe that's principally correct for them to have these privileges because they have, but not because of through luck or inherited wealth, but rather the result of trade-offs, such as working longer hours to take less fulfilling jobs to save money, making personal sacrifices to prioritize needs of their families, and enduring systemic barriers and inequalities to pursue their outcomes. We believe that because they work hard for this money, they principally deserve to actually have these types of options for better healthcare or at least get better services from what they're actually paying for. Secondly, then, is on the idea that it helps lower middle class people to actually achieve what they need. Because like the public healthcare system usually it has been like stretched out so much, like what we said in the frame earlier. A lot of the qualities that they offer can help, but they're usually subpar qualities that don't necessarily help a lot of the people. Private health insurances absorbs a significant amount of portion of healthcare demand by offering private options, effectively reducing the strain on public healthcare systems, with fewer patients relying exclusively on public facilities. Resources like hospital beds, medical staff, and equipment can be more effectively allocated to those who truly depend on public insurances. By diverting middle and upper class income individuals to PHI, public healthcare insurances can prioritize low-income populations and certain limited resources to reach the most vulnerable within their scope. And so my time is up. That's my speech, and proud to oppose.
Cool. I thank member of opposition for that speech. Now finally inviting the government whip to end the case for government bench as a whole. Here.
Hi, can I check if I'm audible?
Loud and clear.
Okay, thank you. Three things I'm gonna do in today's debate. Firstly, how do we dissect OG's case, and why do we outweigh them from the very get-go? Two ways here. Firstly, on the principal way, that comes pretty much a priori to accessibility that they so very much the entire case is contingent upon, right? Accessibility is something that is bound under the state's obligation. Then this means that they also need to prove why it is the state's obligation before they even go into accessibility too, right? We told you in MG why this is inherently a principle, right? And why it is so detrimental that the state has already felt its principle then, right? But then they also need to explain and engage with OO why the existence of PHI makes public healthcare even worse, which they failed to do so. Therefore, the win goes to CG over OG then, right? But then we have to also note that they have to be the state has to be principally aligned before accessibility even manifests too. Therefore, we win on their claims too, right? But secondly, here on the problem with OG's case is that they don't explain structurally why the PHI is exploitative, besides saying that they are profit incentivized. We explained to you why they are structurally exploitative because they deny cases. But even if you buy into OO's frame, that these are competition, that they are actually competition, we explain why is it that how they prolong cases, which makes consumers eventually suffer in the long term. Therefore, we win on all these premise here. But how did CO come into this debate here? They told you a few things. They told you three things. They told you one, they told you new setup that private health insurance have a stretched out option. Secondly, they target lower income demographic and it's good for them. Thirdly, a principle on how rich people work hard to earn this money, so they deserve this. What's the problem with the case here? Firstly, private health care insurance, right? Even if they have stretched out options, in a way, it will still improve them insofar as everyone in this room agrees that they are. It will still exploit them insofar as everyone in this room agrees that they are profit incentivized. Let's flip them at the really best case, right? Yes, poor people finally get a chance to opt into insurance companies. We tell you that when they now opt into these insurance companies, because they are sold better, since the narrative of private healthcare is better than public is so prominent, then they are now likely to be exploited too by these healthcare systems then, without knowing it also. We tell you that they will have more terms and conditions too, right? Because these companies cannot afford to make a loss. They cannot just afford to sell them at a free price, right? This looks like them paying this looks like these vulnerable people paying like probably 40% of their salary just because they are sold to the benefits of this insurance and are bought into this so that quote unquote that it will benefit them in the future. This means that these people are exactly the vulnerable people that needs this money to put food on the table, to even eat, to even use this money to eat, to be slowly exploited then slowly by this healthcare system too. Then they come up here to tell you that rich people earn this money, therefore they deserve it. This claim is extremely outrageous for multiple reasons. Firstly, people do not choose what economic background they are born into in. So if you tell that these rich people, or probably some of them are hardworking, but you have to admit that some of them actually are just lucky and just born into this. They won the birth lottery. If they won the birth lottery, how is it fair to the people who were born into a marginalized society that cannot access into
KOI.
public health care? Then everyone has a health, and some people just cannot climb up the level, even though they work so extremely hard. But we tell you that even if at the really best case that these rich people actually work this amount of money, actually like work so hard for this money, we tell you then it's equally as detrimental when they work so hard of this money and they are actually denied access to healthcare through this insurance and getting exploited slowly and having really bad management in this insurance gets their money exploited. It's equally as
KOI.
detrimental then. But then thirdly, they come up here to tell you the lower income demographic. Bro, exactly what we told you, right? Like, bro, it's cheaper than what then there are like more terms and conditions that are hidden. They promote to you that they help you with cancer, but they hide it to you that they give you pills and like they deny you from getting chemo. If they don't take this down under the comparative, the case on lower demographic income people do not stand. Comparatively, public health care and insurance help you irregardless if you are poor. But then before I move on, due to high demand, yes, POI.
Yep. So how does public healthcare improve under your side?
Okay, public healthcare improve under our side. Let's get into this now. So how do we engage with OO's case? What did they tell you? Competition equals innovation, increased quality of life, and autonomy to choose. What's the problem with the case? I think if you want to talk about improving quality of life on cosmetic and dental procedures, it's something that the rich people can already access to, and therefore it's not that important. But the ones that are important are those people who are marginalized and poor. Then, right? But it's not that these people can choose what they spend their money for. You also have to understand that these companies are inherently profit incentivized and it has to benefit them too. People opt into private insurance because it is somewhat a false narrative that is compulsory to everyone then, right? Therefore, we don't think that even if they know how to buy an insurance and that benefits them, this causes that this PHI system that can still harm these users on a long-term basis, which is inherently harmful then. Even if they are rich, they are eventually slowly getting chipped out their money too, right? There are stakeholders who are marginally in the middle rich type people that are opting into this PHI then. Let's break the deadlock here. Is public insurance actually feasible? Public healthcare system is abundant and missed out mainly because private healthcare is too extremely glorified that creates this narrative that the public system generally sucks. This means that the governments do not really bother with it either. My MG told you exactly why this is and here's how I'm going to build it on, right? You do not have the situation when private sectors just come in and help and suddenly help them, right? It continues to worsen because someone is solving the problems for the governments then, right? Therefore, the governments cannot improve. But when you take the private healthcare system out of this equation, the governments now are then actually forced to actually improve. This looks like the government system actually being forced to put some funds into the healthcare system. Sure, it may be slow, but because these resources can't be enough, let's trade it off here. They keep positing to you that we don't have enough public healthcare. We already posited the problem that under status quo that PHI ties consumers to use more private healthcare, so there is less incentive to prove public healthcare because less people use them, especially the poor. Now, when people have no choice to opt into public insurance and healthcare, there is like more speculation and pressure towards the government to improve. My MG already told you this. Therefore, we win on scale. We win on vulnerability. So proud to propose.
Cool. I thank not member of government for that. Government whip for that speech. Now inviting opposition whip to end this debate as a whole. Here.
Am I audible?
Loud and clear.
Thank you so much. Just turn on my recording. All right. By the way, Axel, if you want to see him, I'll be taking POIs on the 6 minute mark. Prior to the 6 minute mark, I'll be Just raise POI through voice. All right. 3, 2, 1. The main metric within the round are two things, Chair, and let me help you adjudicate. First thing is in terms of which side contributed to a more effective and efficient healthcare system overall throughout the insurance system. Insurance system, not medical healthcare, insurance system, Chair. And second is in terms of which side provided more innovation and options, basically has helped people. Do not buy the metric of scale coming from closing government, since closing opposition is going to take that within the round. There are 5 levels of comparatives that I'd like to prove as to like why closing opposition really had to win in this round. There are 3 things as to like why Jodel is so important within the round, and as well as why CO winning within the round. First is in terms of we were able to give the world insights about the private health insurances, right? We're not just talking about certain countries, but also like what the world, what the insights towards insurances looks like throughout the whole world, basically, that there are certain diversity, that insurance company, varies from countries to countries, from companies to companies, right? Second is in terms of what insurance really is. And the problem with the opening clash, and as well as the opening houses, they weren't able to like really set up what insurance really is. There's certain confusion as to like healthcare providers are basically not healthcare insurances at the end of the day. It's 2 different things, Chair. Do not buy in to the opening teams in terms of that certain definition. In CO, we proved, and we basically proved the benefits, and in terms of mechanisms, how we can help the lower middle income people when it comes to the prioritizing, and as well as getting those private health insurances. Now, so why public insurances are now better, since they are better allocated on poor and they don't need to cater to the high-end services from upper middle class. And furthermore, we can't simply funnel everyone into like public hospitals. The reality of the birth lottery exists, Chair. And for middle class individuals, private health insurance often represents the only viable means to mitigate the risk and limitation that they face, right? They can work hard and secure themselves out of these perceptive barriers at the end of the day. And also, insurances are financial decisions. And I totally agree with opening opposition. But they weren't able to prove as to like the extent of that mechanism that should be credited and co-opted coming from closing opposition. As what Jadel mentioned earlier, as to like how these people from middle class should be allowed to have these investments in the first place. As to like how ROI would look like coming from the breadth of member of opposition. Right? So the stakeholders within the round should be really, the middle class, as they have the as they have the most autonomy as to like choosing the right thing or not, right? As well as helping the system too. So now I'll be clashing first in with I'll be taking down closing government first, and 3 gunshots, right? So first things first, CG cannot win on scale and vulnerability. Why? Because they're just rehashing the exploitation case coming from opening government. I think that it's not really proven as to like how exploitation would really look like coming from closing government. Why is it so? Because they're not looking the bigger picture. They're just, in their utopic world at the end of the day. Why? Because states are not dumb. There are legislations, Chair, wherein states will definitely make sure that things are not getting exploited. There are there are proving mechanisms as to like how legislation would really help the state the situation better in terms of the private insurance company. So they're not really getting that exploited. But even if you don't buy that, those abuses happens on really large private insurance corporations only. And guess what? Luigi was in a multi-million corporate CEO. He shot down like a multi-million corporate CEO, and that's not happening throughout the whole world. And this is where closing opposition was able to elevate within the round. We're just not, we're not just pointing out, like specific things on certain countries, but like throughout the whole world, right? And now I'll be now flashing as to like how opening government really loses this round. I have 3 things for them, right? So opening government told us about how more access in healthcare, will lead towards financial access, hence towards promoting public health insurance, or public health healthcare, since they were able to like really set up how insurance would look like. I think the main response that I have to that is in terms of like the corruption at the end of the day, since public health insurances are like state controlled, right? So it's not so therefore, if you're to like bite in towards that certain mechanism or probably benefit coming from opening government, it's really not gonna happen, since there, corruption can still happen. And comparing it to closing opposition, at least there is a certain safety net coming from us, right? At least there is a certain safety net for those low income people, right? Now, I think I think coming from OGs, they told us about the stress for the poor, the poor. I think this is a symmetric harm. I think the harms presented come from open government is as asymmetric as them, right? So now, one of the reasons why I think closing opposition really had to win over opening opposition are two things basically. I think first, I felt like there is the definition coming from opening opposition is untrue. I felt like I think they weren't able to like really tell us how insurance really looks like, but they were able to like really provide some sort of a premium whatsoever, but clearly wasn't able to like really tackle that certain discussion about how insurance looks like basically. Yeah. So, and it's not just that. In terms of how they try to tell us about it lifts the burden on public healthcare, right? On the public system, wherein there's going to be like less financial burden for the public system. People pay tax, and and we deserve to like have a better system as in the public healthcare. But at the end of the day, this should be credited to closing opposition, as we are able to provide a mechanism as like how we could help the low income people indirectly, coming from my first speaker, right? So the reason why the reason why there are a lot of the reason why closing opposition really had to win within the there are I'll be giving you like two metrics as to like why closing opposition had to win this round. It's in terms of number one, gravity. I think in terms of how we are able to give marginal benefits, even if it's indirect, it's still marginal on how we could uplift the low income people, as to like how the mechanism would look like closing opposition, and as well as how it's in closing opposition in terms of the gravity of the exploitation, right? At the end of the day, there are still safety net as to like how legislation would look like, right? And as well as how the situation with Luigi is something that's in minority, right? So I think closing opposition really disputed that certain harms at the end of the day, and as well as yeah. So yeah, and I think I think I'm good. Thanks.
All right.